Hi, Bree. Can you hear me?
Yes.
Yes.
Yeah, we can hear you. We can hear you.
Oh, okay. Sorry about that. That was fun. Can
Well,
you see me?
Yeah,
We can see
no.
the boardroom, Diane. I think
Yeah,
just
we had you, I think, when you first.
Oh, okay. I can't see myself. So
There
something's
you
wrong.
We can see you.
Okay, perfect. Thank you.
Okay, well, thank you all for joining us and being patient while we worked out. This is a new setup with the panelists. So we have, every time we change something, we have to figure out the tech that goes with it. So I just want to take a moment first to acknowledge that we are on the traditional unceded territory of the Lheidli T'enneh. And if we all just take a moment and reflect on that and think about the beauty of these lands and really what it means to us to be here to study and live and enjoy our lives on this territory. So I unfortunately didn't make it in person to the first one, HRI seminar series of the year, but this is our second one here. And just to introduce the seminar series committee, we have Leanna Garraway, myself, Kendra Ferber, and Rihanna Robinson has just joined us here. We're very excited about for this year. And of course, Bree keeps us all organized, does all the work behind the scenes. And we have a lot of contributors. Just try and pop this so you can see to the seminar series. So it's not just the Health Research Institute, it's interdisciplinary. So we have the School of Health Sciences, School of Nursing, School of Social Work, Psychology, Northern Medical Program, and our financial sponsor is Sun Life.
Kendra, if you want to just hit the little minimize button.
Okay, I'll be. And just a reminder of our upcoming seminars. So once a month we meet. You can find this information on the website as well. Next month we have Dr. Vivian Josephowski that's joining us. Great. And another reminder here, coming up quickly is the Northern BC Research and Quality Conference. You can look to register for that. Do they go to the HRI website to find it?
Yeah, absolutely. And to register, which is free.
So it's free, so you can come out and network and find out what kind of health research is going on here in the North. So today I'm very excited that we have a panel to speak with us, and it's geared towards working in partnership towards health in the North. Our panelists joining us today, I'll start first here with Marcelo Bravo, who is the patient-oriented research and knowledge translation capacity building lead with Northern Health. Leanna Garraway, who is the Health Research Institute manager here at UNBC. And together, Marcelo and Leanna co-lead the BC Support Unit Northern Center. And then going next over is Diana Kitzner, Carolyn Sanders, Associate Professor, School of Nursing. And then online, we can't see you, we'll see her again in a second, is Diana Kitzner, who is the lead for the climate change and health at Northern Health. So I'm not going to do the work. I'm going to let the panelists do the work and introduce themselves a little bit further. Could you let the audience know just a little bit more about yourself and your involvement in health research in the context of Northern BC? Marcelo?
Thank you very much, Kendra. Thank you very much, Liana, Bree, and all the HRI Institute for this invite. Should I be talking to
No,
them?
it's okay.
Okay. Okay. So as Kendra referred, my role is the lead for knowledge translation, capacity building, as well as patient-oriented research at Northern Health. And my involvement, particularly in health research, it's to help researchers to enable the structures in order to facilitate research. There's different ways in how I'm involved. One of them is a new task force that we call the research engagement team, which is part of the research evaluation and strategic analytics department in order to offer more facilitated services for researchers and our students in order to understand what are the different requisites as well as opportunities in order to successfully conduct research opportunities at Northern Health, or pretty much in the North. So this is one of the ways that I participate, which is being part of the structures. The other part is to enable structures or enable mechanisms for allowing new researchers, students, to take advantage of the grants and opportunities, and being a connector, liaison of potential opportunities in order to develop our future resources as researchers, as well as seasoned researchers or professors, etc. So I think part of the benefits of my role is to serve as liaison between these two communities, and I guess now it's also formalized as my co-lead role with Liana Garaway. So yeah, I have further reflections about partnerships in the North, but pretty much this is my role at this point. Yeah, over to you.
All right, thanks, Marcelo. So as manager of the Health Research Institute here at UNBC, the role of the HRI is really to help facilitate health research across UNBC. We want to be a space where health researchers here can come to us for assistance, and we offer assistance for them and their partners to undertake health research. The HRI also, for UNBC, we hold a lot of partnerships, or we work on a lot of partnerships for them, including with Northern Health, including with the Provincial Health Services Authority, including with the Rural Coordination Center of BC. So, and Marcel and I work a lot together with the BC Support Unit, which is Health Research BC. So that's really my role in partnering to help health research in the North. Caroline?
Okay, thank you. So I'm from the School of Nursing, and as you can tell from my wonderful accent, I'm not from Canada. I'm from the UK, from Manchester, and I came here, I'd like to say 6 years ago, but I think it's probably 8 years ago now, so I need to learn to count. So my background was different. So my background is a clinical academic. So I'm a nurse who did a PhD and stayed in practice rather than went into academia. I only went into academia a little bit when I finished my PhD, and then I did a few days a week here and there, but did plenty of research that was patient orientated, as I worked with families who would be able to raise the concerns and issues that they had in their everyday lives. My background is pediatrics, so I've always been a kids nurse and worked and had the privilege to work with children and families. So I left the UK to come on a grand adventure and ended up in Prince George as my first port of call, and stayed because it's a really lovely place in the world. And one of the things that I came to realize very quickly is our healthcare system here is not the same as what I was used to. And certainly how our healthcare and our post-secondary institutions work together is not the same as I was used to. So it was a very interesting space to come as a nurse without then being able to practice initially, to have to go back to school and get my RN so that I could practice here, even though I'd never left practice at home in the UK, and then start to find a research pathway. So for the years that I've been in research, I was incredibly privileged to be clinical and know people who were interested in raising questions with me, which would be the children and families. And then to come to a place where suddenly I was just a researcher and not having a clinical capacity, wow, that was really different. And a real shock for me is to say, wow, don't researchers have it really hard without having a clinical component to their work opportunities? So for me, it's been taken time to recognize as an immigrant that there are many challenges when one arrives in a new country and has expectations. You know, the loss of my clinical identity was a real challenge. I do have that back now, so I feel better about the world. And I also recognize that not having grown up in BC and built those formative networks within a university structure actually are really, you know, coming to it later in life, because I'm near retirement, I do see it on my horizon, then was a real surprise about how hard it is to build connections when you don't actually have the taken for granted ways of working with people. So I think I bring a different lens of having to then go out and make a whole new group of friends in a whole new country, in a whole new way that didn't work the same. So I think if I'd have told my previous self what it was like, I may have had second thoughts, but I didn't. So I'm here and I love it. So that's where I come from. So I can offer you something different in that kind of rich way of thinking of beginning again when you're in your 50s. Okay. We can speak to that if we like. And then I'll hand over now, I think, to, is it Diane?
Yeah,
You're
Diana.
online, Diana? Oh, she's behind me.
Yeah. Well, we're glad you.
Hi. Thanks so much, Carolyn. Yeah, and I'm slightly mortified. I'm huge on the screen, it looks like. But hello, everyone. I am calling in from the territory of the Tsimshian First Nation today and peoples on Kitson-Kalan territory in particular. So this is in Terrace, BC, where I am attending the Population and Public Health face-to-face gathering this week that is hosted by Northern Health. And so my role at Northern Health is the lead for climate change and health. This is a new role at the Health Authority. It's been in existence for just under 1 year. And I am originally from Germany and arrived on Klitleitini territory in Prince George in 2002 and started my journey as an undergrad student and then graduate student at UNBC, and really went into the research direction quite early on and trained as a social scientist, working in part on tourism and environmental studies and also Indigenous community kind of tourism development pieces. And yeah, so I kind of have I was listening to you, Caroline, tell the story about how you were in clinical practice and then are coming into the research world. So I was relating, like, I'm coming from the research world, but now I'm finding myself in public health. And I did a PhD overseas in New Zealand on environmental change, and this is where climate change kind of became more and more part of my practice and kind of professional development. And yeah, before coming over to Northern Health, I worked on a research project at UNBC as research manager for 5 years, looking at the cumulative impact of resource extraction and development in Northern BC. And that was really one of the places also where I just saw the interactions of public health and impact on our population health in the north, and also the gap of knowledge that we have in terms of impacts on health from various developments in the north, and so the need for research. And so right now my role at Northern Health was really focused around starting up a climate change and health program, in part beginning with the population and public health program, but then kind of branching out to the wider organization overall. And one of the first tasks we've been given by the Ministry of Health is to conduct what's called a climate change and health vulnerability and adaptation assessment. And so this is kind of my primary role right now, is to help move along that work, understanding what are our climate change risks in the north, what can we anticipate will be the impact on our health, and how will we adapt to those impacts over time, and how will we become more resilient over time. And I think I'll leave it there for now.
Thank you, and again, thank you all for joining us today. So most of you may know there's been a strong history between UNBC and Northern Health, beginning with the signing of a memorandum of understanding in 2010. And so I'm just going to send it to Leanna for a second, just to give us a brief background on this.
Sure, just a quick explanation of what that means. So in 2010, UNBC and Northern Health signed a memorandum of understanding, which is really the framework for all the work we do together. UNBC and Northern Health are actually a pretty close relationship, unusual. Marcel and I work with the different health authorities, and this level of partnership isn't really seen other places. It does have a lot to do with the fact that we are like lower resource, lower person population, so we do a lot with a little. But the purpose of this memorandum of understanding was basically to look at, we have on UNBC, we have research and education. Northern Health, we have clinical practice, we have health care decision makers. So we work together to identify the needs of the North and then to work on those, to focus on those. And this memorandum of understanding, every few years, it's refreshed to ensure that we're looking at the right pieces. I think there's been four, well, I don't know if refresh is the right word, but we relook at it and we'll re-sign. And actually that work's going on right now. We're in the middle of a 3-year kind of relooking at our strategic directions. So yeah, so it's really briefly, I don't know if memorandum of understanding is, people really know what the heck that means. So.
Yeah.
Mm-hmm.
Well, thank you. Yeah, I think it's more just having that formal kind of relationship, kind of the roles and responsibilities, and putting that on paper and making a commitment to work with each other. And then also last year, we had the launch of the Northern Center for Clinical Research, and that is actually a partnership between UNBC and Northern Health. So there's more players coming into play, and hopefully this really helps move things forward in the clinical world, but also, you know, benefiting researchers here across campus. So we really, I think for this session, had the idea that we wanted it to be a discussion with the audience. So I'm hoping you guys are thinking of lots of good questions to ask our panelists. But before we do that, maybe I'll just go back and ask them to speak more specifically how you engage with this partnership between UNBC and Northern Health, and maybe give some examples of how you feel it's benefited your research, or more generally research in the region. So do we have anybody that would like to start? Or do I?
You're all looking at me.
I want to give everyone the opportunity to speak first.
Okay, then I'll go first, and I'll pick an example because I'm an example kind of gal. Is to say that working with Northern Health has been a really interesting journey. How should we say that? Yeah, it's full of opportunities. And actually what I think I'd come to realize is Northern Health is part of the picture, but it's actually not all of the picture. So there are other partners we work with as well that are also aligned with Northern Health. So if you think about FNHA, for example, we know that there's overlap in the work that we do in some of those spaces and places as well. So within a nursing program, if we were completely honest, Northern Health and UNBC can't survive without each other, because one has to give the clinical practice and one has to think about what we're doing with the practice opportunities for those that are going into professional programs. So one of the things that came to light more recently, and how we developed some partnerships, and it was at different levels of, I suppose, people who are players at the table from Northern Health, who are interested in clinical placements and who are interested in our workforce. And as part of the work in the MOU, it was very, and it is very evident about the fact that you will have all heard on the news that we're a little short of nurses. Okay, it's a bit of a problem. And even when we do get them, we do seem to have a bit of a struggle keeping them. And then we have lots of internationally educated nurses. And of course, this speaks to the, you know, I speak from the heart, if you like, about the fact that actually, when you actually get here, there are many hurdles for you to overcome to be able to come and practice as a nurse in BC. So our partnership, working with different levels of leadership within Northern Health, those that were working to be able to deliver care and in our community in acute care contexts, as well as those in senior leadership, such as Aboya in her professional development planning role at Northern Health. We started to work on internationally educated nurses and trying to understand how many we had, because there's a forgotten group that we've identified who live in the north. So currently we're ticking around about 140, 150 people who are living in the north who are nurses, who would love to go back to work in the workforce, but actually are really struggling to get back in there for a range of different reasons. So part of the work that we're doing is trying to discover what those reasons are. Also to work with our registration, which would be for us BCCNM, which is how we get our license, and also the process by which nurses get their license. It's very convoluted. And despite the investment of millions of dollars from the government, it's not actually always as easy as you think, because what happens is the hurdles they've set in place are really interesting. You can only come if you're a particular type of citizen. So if you are on a work visa, BCCNM would love to have you, but actually if you need additional education, there's no PSI in BC that will take you, because that's the criteria for admission for entry. So how our systems are set up have started to help us identify is the fact that we're not working collaboratively. And so coming through and working with Northern Health, we've managed to work with the navigator there, because they employed a navigator, recognizing that trying to get workforce is a real critical issue. We managed to use some leverage from what the BC Ministry have developed in relation to their resource planning, which has 70 items in it that came out last September, to be able to say, hey, we're going to make a difference and this is how we're going to do it. And we also started to find that group of individuals who feel that they're a little lost right now, who would love to come back to the workforce but don't know how to get back into it. And the other thing that we've identified is the fact that in the north we don't have any education approaches and opportunities for them. And the current assessment criteria is you go south. You go down to one of two places at KPU or BCIT to be able to get assessed. That's your option. So regardless of you leaving your community or your home or your family, that's what you have to do. And I can be confident in saying that I can be pretty much assured of what kind of outcomes people are having in relation to these are the courses you'll need to do, which takes us all the way back to the fact that actually we don't have anything for them to access. Here in the north, online there is a wait, and actually a lot of individuals can often feel unprepared to go back. So we're currently just running some focus groups between ourselves and Northern Health to be able to look at those that want to come back to work, which can say we're ticking at 150 and we only did one social media push. So I bet you there's a lot more. And then also to look at those that have already made the transition back into the workplace, because we're very curious about how do we keep you? You've chosen to come and live in BC and you're living in Northern BC. How do I keep you here? And how do we make sure that you can achieve your career aspirations? Because the literature tells us that actually many immigrant nurses will not be treated as fairly as Canadian trained nurses. So we would like to explore and see whether that's a truth in the north. And if it is, what are we going to do about it? So we've got lots of things that we need to work together, and then building that relationship between us as a HRI and a PSI, you know, who's going to do the work around the education. And so we've raised this with the ministry, and we've now managed to get different conversations going at a variety of different levels because of the relationship that principally Aboya and I have. So her in her role at Northern Health and me in my role here at UNBC, to be able to find all those little ways to be able to access tables where people are having these conversations and making these decisions. You know, often don't we say, don't have a conversation about me without me? Mm-hmm. So what we're finding is for a lot of internationally educated, let's call them healthcare professionals, we're making decisions without them. And that's part of the problem. And we're not providing with the opportunities that they are curious enough, you know, they want to seek them and they want to stay here. And holy moly, I had no idea how many people lived in Dawson Creek that want to be nurses. You got 50 sat in Dawson Creek. Really? Yeah. They were just in Dawson Creek or like, I'd love to come back to nursing. Yeah. But we're all over the north, but predominantly there's a big, the cluster pull is through Northern Lights College, has an administration diploma there. And what happens is lots of people gravitate there and come on a student visa. And what's happening is the fact that then the challenge really is becoming the fact it doesn't guarantee you to get back into the workforce in health. And if it does, you're going in a different route. When people then say, but actually I want to go and be a practitioner. I want to go back to being a nurse. How do I do that? So we need to one of the goals is to work with Northern Lights to be able to say, how can we adapt, or what could you add in as additional course material so that we can fulfill some of the requirements that I can guarantee BCC&M are going to need to ask you to do. So that's how this has helped us build that framework to open that conversation to begin, because it's really difficult to get any research funding in this area to even get us going, because actually people say, well, the ministry's looking at it. The ministry's just allotted X amount of $1 million to sort this problem out. Good luck. I don't believe them. And I'm on record, I'm videoed, I'm recorded. Okay, I accept that. I still don't believe them.
Yeah, we can.
You can't relate
We
that.
can't beat up that part, I don't think.
Yeah. I think they're trying, don't get me wrong, I think they're trying, but I don't think they'll succeed easily. It's going to take many players at the table to be able to do that work.
Well, thank you for those thoughts. And I think what I'm hearing too is, we like to stand here and say, oh, we have a partnership between UNBC and Northern Health, but it's really UNBC, Northern Health, and the communities that we're trying to serve in terms of the partnership. So maybe I'll go to Diana here online again. And get your thoughts about how you kind of engage with the partnership and the benefits you see. And then I'll come back into the room.
Sure, thank you, Bree. I can't see you, but thanks for doing such a great job of moving us through. I think the immediate benefit has been for us, we were and are in need of knowledge synthesis work just around what do we know about climate change events and longer term impacts on the health of our population in Northern BC. And so we were able to work with the Health Research Institute Knowledge Synthesis Center together on this. A project to review academic literature and then also gray literature and kind of reports and such on this topic, because the academic literature that includes Northern BC specifically is fairly limited in this context. And so to begin with, we're looking in particular at extreme temperatures, extreme cold, extreme heat, and wildfires and equality. And so we were able to contact the HRI Knowledge Synthesis Center to do that work. And so I see that immediate benefit because, if we were running a project like that, just alone at Northern Health, we do have a library, but it is much more limited in terms of what we can access. And so the partnership with UNBC really facilitates that, particularly through the HRI. And yeah, so it's a pathway to knowledge. It's a pathway to build, I think, interest and research questions around this topic in Northern BC that are not currently being looked at from a health perspective. And so that's kind of where I'm looking forward to into the future. Where can we go from here? Yeah, so it's a conduit, a connector for me, the HRI. Without that, it would really be missing something in terms of where are the health connections to the research institution at UNBC. And we do have another partnership with Dr. Margot Parks as well on a research project. And of course, I think she's still the co-lead for the HRI. Correct me if I'm wrong there. Yeah, thanks. And so we're also pursuing a research project with her and her team around the co-benefits of water, land, and health and climate connections in Northern BC with the lens and looking at lessons from intersectoral, intergenerational, and Indigenous-led approaches. So that is really important work around for the climate change and health portfolio and the way that we are wanting to pursue this work at Northern Health. And so it's just another kind of conduit for us to have that existing relationship. Yeah, I think leave it at that for now.
Thank you, Diana. I'll just send it both to Marcelo and Leanna, and you can spread out.
You want me to go?
Yeah, you go ahead.
Okay. Well, I think we can extend a little bit more on what Liana began discussing with the memorandum of understanding, which is a living document that we're actually working actively into enabling more activities, program supports, etc., in order to continue enriching these partnerships. So the MOU, it's comprised of four different groups. The research and knowledge translation that Liana and I are part of.
That group.
We're part of that group. Communications and collaborations, education and opportunities, and cultural safety and reconciliation. So Liana and I are part of the research and knowledge translation. And one of the interesting projects that we have that we'd like to continue working on that. It's I think we haven't defined the name, but it's something about the research culture, research ethos for the North.
Yeah.
So this is something that we'd like to deliver, which it's going to be some sort of a basic enunciation or manifestation of sort of research intent that can help to guide some interest for UNBC as well as Northern Health researchers, etc. Because independently of the disciplines, etc., hopefully we can a little bit come together to one of a unified front in terms of areas of research and priorities of research, etc. Then we can kind of dedicate a specific programming. So we know that we, as kind of as been referring, we share a very unique Northern identity, and because of our size, because of our geography, because of the limitations in terms of human resources, etc. So all these components kind of brings a different or a uniqueness within the space that we live and occupy. So we're working towards having kind of like a purpose or intent of purpose, calling research ethos, that will continue guiding different programmatic activities that are planned to be delivered. And then there is also another very important piece of collaboration, which is our conference, but I will pass it over to you.
Oh, sure. Thanks. So the way I personally work a lot with Northern Health in partnership is because my role is really to help facilitate research. It is in, as Marcelo was alluding to, events, networking events and opportunities. So Northern Health and UNBC, or the HRI, the UNBC HRI, we are co-hosting the conference November 7th to 9th. That happens every 2 years, and that's a fully co-hosted event. We've got presenters from faculty and students from UNBC, but we have a lot of Northern Health clinicians and data scientists then they're going to present on the quality improvement work and evaluation work they've done. So that's an important role we play I in particular play is in providing these knowledge translation opportunities, such as today. This is a partnered event we're putting on. And last year, UNBC, Marcelo Bravo from Northern Health and a UNBC researcher actually put on a knowledge translation workshop for students. And another way I work in partnership with Northern Health is, as Kendra had mentioned earlier, not just with Northern Health, but it's a partnership between UNBC, Northern Health, and Provincial Health Services Authority. And the HRI ran a seed grant for 8 years, 9 years. We gave away 26 $10,000 seed grants, and those research teams had to have a UNBC member, a Northern Health member, and a PHSA member. And so our role was to help facilitate that. We ran the seed grant program, we managed the seed grants, we communicated with the seed grant winners to help keep them on task and help them out if they needed it. So yeah, that's a lot of what I do, a lot of events and things with Northern Health and with others.
Yes, and they all go very smoothly.
Oh yeah, just like the start of this event. It just never hit.
Okay, so I am gonna go to the audience now, and if we have people online that wanna ask questions, Rihanna here is monitoring the chat, so just please type in your question there and we'll read it out for you.
One question I have is that with this opportunity or the collaboration with Northern Health, can we see a organ donor bank coming up soon at the north? Because my work is mostly on mouse brains, so if in the future I want to translate it to and study pathology on, let's say, Alzheimer's patients' brain studies or something. So one of my friend's grandfather actually donated her grandfather's Alzheimer's brain, but then since we don't have the facilities here at North, the body was transferred to Vancouver, and things were done there and was sent back here. So can we see something of such collaboration in the future?
That's a really interesting question, and that's, if anybody else wants to jump in, I think that as Kendra had mentioned, we don't have facilities for that right now, but a huge gap has been in any sort of clinical research. The resources for any kind of clinical research here in the North. And so just a year and a half ago, the Northern Center for Clinical Research started, and it is really just getting started. They don't even really have a physical space. They just have a series of people working out of different places. But and I'm not a clinical researcher, but even Kendra Lenny may be able to speak with that. That might be something that.
Yeah, I think there is specifically Northern Biobank for cancer tissue right now that's getting often that has existed. There's been a lot of work and consultations with different communities and particularly Indigenous partners on getting Northern Biobank. So I guess, and that is a really good kind of point, is because, right, we talk about doing clinical research or health research and being representative of the entire population. But in fact, even with biobanks, typically you're getting specimens from people that live in large centers. So I really do think it is important to explore how we could have, more regional representation kind of in kind of our, not just clinical, but pathological research as well. So.
A question for Marcelo. So you mentioned that you enable mechanisms for grants and stuff like that. And so I'm just wondering if you've seen anything cross your desk that would be really exciting for students to know about?
Well, I think the ones that are more exciting are connected to patient-oriented research. So Liana and I, as co-leads for this center, we come across different awards. Some of them specifically to patient-oriented research, some of them not necessarily attached to other organizations that we work with closely, which is, for example, Health Research PC, as well as HRI, etc. So I think you also HRI communicate different awards and activities.
Yeah,
to students,
we do try to keep, when we see things come across our desk, we do send them out over our social media and our HRI membership list. I haven't seen anything recently, and specifically for students, but I know, So but I do know that the Office of Research at UNBC also has a really good website and newsletter about that.
Yeah, and another two ongoing opportunities. One is with MyTax that offers internships opportunities. MyTax puts a little bit of funding. The host organization puts a little bit of funding as well. So that might be also another avenue, and they have different programs. As well as BC Near, they have some also.
Marion has actually received one of their.
Oh, perfect. Okay. Yeah. BC Near for they've been piloting different type of grants as well, particularly for students. Yeah.
Sorry, we couldn't give you a big gem there.
No, but you guys are also part of our priorities.
Yeah.
Mostly with Leanna living here in the UNBC, but we're always thinking about you guys. So
Mhm.
And I would say that lots of organizations are interested in partnering. So if you have a partner, I mean, reach out to the HRI and they might be able to connect you with, say, Michael Smith, Health Research BC, or another funding agency that looks to kind of partner on even scholarships or small grants and things for students.
Mhm.
Is there somebody with a similar position to you in FNHA? Marcelo?
I don't know because they've been changing personnel lately. That's actually a good question to know where they're at. But I can try to find out and then just loop in back so with that information. They might have some. Yeah.
Was the question about a knowledge translation lead? Sorry, at FNHA?
Yeah, Diana might.
Yeah.
Oh,
So
yeah,
somebody Marcelo's position, but through the sorry,
Yeah.
MS
First Nation Health Authority.
First name.
yeah. So they do have a director for knowledge exchange and translation, and it's also new kind of research connected department. That's been in existence for a few years now, but has been kind of shifting over time. I just happen to know because I also worked at FNHA for a while, Marcelo. So yeah, they do have somebody that's like not exactly your counterpart, but they do have a department that
That's a good
is
reminder.
building. Yeah, fair enough.
Diana,
Yeah.
do you know where somebody would find that information if they wanted to reach out and contact them?
Yes, I mean, I think if you just put into Google FNHA knowledge translation, you'll be able to find that person, but otherwise you can also contact, I mean, I can find it. I know I can't think of the name right now, but I've come across that person a couple of times, sorry.
You guys are getting quizzed.
I met Katie from FNHA yesterday at the PGNFC meeting. So I think if you just give me your email, I'll connect you later because Katie has just picked up a new role. So I'm looking at Rihanna because she was at the PGNFC conference as well. So she's just picked up a new role and part of that will be the I'm sure she's the research and she's doing community projects. So I think she would be a good connection to be able to put you in the right place. So that would seem fair, wouldn't it? That was right yesterday, I think.
Yeah.
So maybe I'll ask, building on that a little bit, if I'm a researcher here at UNBC and I want to kind of start exploring these partnerships with Northern Health or community partners, and then vice versa, if I may be at Northern Health and have a research question and want to explore partnerships with UNBC, what kind of advice or tips could you give people on how to kind of initiate those contacts?
Well, from my perspective, we do get, because a part of the HRI's role is to try to network and connect people. I received questions from people from Northern Health or other organizations asking, do you know who works in this area? Or I'm putting a CIHR grant in and I would like a Northern researcher. Do you know who might be interested in this? And I've been able to connect them, but also the Office of Research here is great at that as well. They also receive a lot of those requests. And the HRI is, we're very excited that sometime this fall, early winter, we're gonna have an online database of all of our members. And that's going to be a fantastic networking piece because then you'll be able to, if you're a member of the HRI, you can go in and you can do a search and say, well, who at UNBC does diabetes research, or who of the UNBC or HRI partner members might I want to talk to about this? Yeah, little plug. That's up and coming.
I don't know. Carolyn, you said when you were new here, you were kind of in an environment where you didn't really know people and you weren't working in the clinical world. So how did you kind of start in terms of building those partnerships?
In all honesty, you can send that original email, you know, that primary email. Hi, we've never met, but I've read your work and this is a great way for me to connect. I am new, and you tell your story and you're honest, so that you can reach out to, I don't know, an author that you may have read on their paper that's of interest to you, an area of research that you've always been curious about. You know, if you flip it on its head and think about it the other way around, those people who are in academic institutions will take value in the fact that somebody from external has reached out to them to say, hey, I've read your paper. I'm really interested in the work that you're doing. Because they get measured on that. So that's part of their prerequisite to be able to fulfill their obligations to their academic position. So, you know, to contact people is very normal. Don't ever be afraid of it. How did I start? I edited a Canadian textbook. And so it was about Canadian pediatric care. It's different a little in some places than what I was used to. And so I made a concerted effort to go and find all the pediatric scholars that I could across the country and started to try and reach them and connect with them. And I also went to BC Children's Hospital and found the list of people, and I would ring them and I would email them and I told them I was doing this textbook and how did we want to update it so that it was reflective of multidisciplinary partners. It was reflective of what was currently happening in areas of excellence in Canada to be able to showcase the work that we were doing. So for me, that was a great way personally to find people, and then friends of friends, you know, they became friends and they would then send me in that direction. But I'm also honest in the fact that it's taken me a while to then be invited to go and work in different ways. So I now work with BC Children's and I'm looking at research with, you know, that cohort of individuals, but also the research that I did before I got here. It doesn't really exist in Canada. So it's really difficult. So my research area is children with rare conditions, particularly intersex or sex, when children are born with different sex characteristics. So what that meant for me was I came to a landscape where there was no Canadian evidence in the literature. There still is no Canadian evidence in the literature, except for we've now published and done some work, but there is nothing. And I'm very aware of that, and the fact that then that means getting grants is very difficult, and sustaining that level of engagement in an area when Canada is just not there yet is very hard. So just don't be afraid to reach out to people. Don't be despondent when you get no reply. Move on to the next, and yeah, don't give up hope. That's what it's about, really.
So different grants usually have got their own criteria for proposal writing for grant implementing. Can HRI assist or support students with such requirements?
With grant writing, no, unfortunately, we don't have capacity for that, but I would definitely reach out to the library because they run grant writing workshops and those are fantastic. Yeah, just take a, yeah.
Yeah, but I had a question with the library today and they said they don't do that, so.
Well, they run, yeah, I did not a single her out.
Yeah.
It's research. They run grant workshops and I know they had some in the summer. So they're usually actual events that occur and they bring in somebody from usually Don MacArthur for the Provincial Health Services Authority. She comes up to Prince George and teaches them. So yeah, you could do a little, I don't know if there's any up and coming, perhaps not if the library said no to you, but do a search online and some information should pop up about them. Yeah.
Yeah, so the Office of Research does a wonderful job and they do workshops mostly for faculty. But certainly if your faculty or your supervisor should be able to get access to kind of those types of resources.
Thank you.
I mean, just being resourceful and in line with Carolyn's comment, as your supervisor, as friends, like perhaps second part of eyes, etc. I mean, sometimes it's great to have kind of like a dedicated coach for grant writing, but sometimes you just peers or another prof can take a quick read about it and give you like, is it because sometimes even some proposals get just disqualified just because there's not a specific alignment. So basically you can really tell that. Or it's about budget, or it's about knowledge translation activities, and you can reach out to either Liana or myself. It's connected to Northern Health, etc. So yes, it's great to have a grant facilitator access, but sometimes maybe you can just kind of divvy up and access some other informal resources, and you can have a second part of eyes looking at it. Yeah. Don't feel like, oh, because I don't have access to that resource, then I'm not gonna be successful now. Even though accessing grant writing, sometimes you don't get it. So, and also you become better while just attempting. So yeah, you learn through the process.
I think it's a great question though. If you just, Nicole, is there a way to know who across UNBC has been involved in, for example, some of the trainee awards that come out of CIHR? Not that they can obviously disclose what they've had because there's confidentiality, but is there opportunity then to run workshops? Because there are also particular components within grants that can be particularly difficult to write. So if I think about EDI, no matter how you write it, depending on who's reading it, you still can't get it right because it depends which lens somebody is originally, is primarily coming from. So I think there is definitely scope to, because we're all always learning. Is there scope for the research office or something to propose to the new VP research that there's an opportunity to run such events for students and faculty so that there's a shared way to do that learning?
Yeah, we're always looking at trying to bring that type of training to UNBC, and as you mentioned, the grant development workshops, we run those annually, and those are open to students as well as faculty and postdocs. But yeah, definitely there's a lot of requests from faculty and students as well for more training on like research data management, research security, EDI, all those things. So it's definitely something we'll look into.
Yeah.
The Office of Research actually keeps, when we submit a grant or it's successful, one of the two, you can give them permission to share it.
Yes.
Or if you contact the Office of Research and ask, they might go out to, a previous faculty or trainee that was awarded that in previous years and get their permission to share kind of a limited amount of the proposal with you. So.
Yeah. And do we keep a record of who's working with CIHR, for example, of those kinds of things? Because they're not necessarily collated anywhere. I'm just trying to think of, does the research office know who's reviewing what for which body at any one time?
Like on the tri-agencies review committee?
Yeah, so on those kinds of review, because it gets published the year afterwards, but it doesn't get published at the time.
Yeah,
we don't keep that.
We're aware of people who've sat on those committees in the past, but not, unless people disclose that, we don't know currently who's on those committees.
Another potential avenue is when I was doing my PhD at UBC, the graduate student body or association would be very active into that. So I'm not sure whether you can express that interest, and once they organize the research week, then you can also develop some of the workshops on their own. Yeah, graduate student association.
So I have Marcelo. I know we were fortunate to have you here putting on a workshop during Research Week last year. How how do we know what you're up to? Or if you're giving workshops? Because I think KT is becoming a bigger and bigger thing, and say for a biomedical scientist like myself, it's sometimes not natural or as natural to think about how my research is going to impact society when that might be, you know, 10 or 20 years down the road.
Yeah.
So I know Michael Smith has a lot of good resources, but I'm just wondering how we kind of tap into what you're doing and take advantage of.
Great, and this is also in connection to the question, because some of the grants ask you about the knowledge translation plans or components. So but the good thing is that we have office hours for doing that kind of work. Yeah, so you can access to that. I don't think we have a ranch to come back, but we would be happy to come back. I mean, yeah, it was we just started that. I think it went well. And then we went to different we follow up with different invitations, classrooms, etc. But yeah, thank you for connecting Health Research BC. They have a wealth of resources, KT Connects, programs, webinars, etc. So and also connecting with Carol's comment, depending on the type of award or competition, the KT lenses can change. Yeah, because there's not just one basic formula of KT. Depends really the type of competition, etc. So there's a wealth of potential avenues to how to do effective knowledge translation based on the audiences and based on the intent and based on the type of work that you would like to do. However, there is I mean, as a general concept, there is more interest to particularly research intensive universities that receive public funds. There is a major interest to give back to community, give back to society. So basically, in what ways that research, even though might be biomedical or very specific, in what ways the public as well as very specific communities might benefit out of this work. Yeah. Once it's an applied type of discipline, usually it's quite straightforward. If it's more basic or theoretical, there are sometimes challenges, and sometimes there's ways to work around it. But if it's quite applied, it's usually quite straightforward. Yeah, it's one of the newest requirements that we have to plan in advance, and I'm happy to provide some help.
Okay, well, we are just a little over an hour into our time now. But I'll maybe kind of go to final thoughts, and then that'll give some time if people want to come down and connect with the panelists kind of individually. But maybe I'll start our final thoughts with you, Diana. You know, how do you see these partnerships evolving in the future? And what are some key hurdles to address? Or what do you think some real opportunities or strengths are here to increase health research capacity in Northern BC?
Yeah, thanks, Bree. I think a couple thoughts, just echoing some of the things that were said by Caroline and Marcelo and also Leanna. Just I think in the North, because of the way we're resourced around health and research, there's a strong need to collaborate and to be innovative about how we address problems that we face in the North. And so how do I see these partnerships evolving into the future? I think my hope is that they will become stronger, that we will bring more partners to the table, and that we will bring more diversity of perspective, and also just build stronger relationships with our communities in the North around these different types of research gaps that we have. And hurdles, there are many, funding being one of them, and you've just discussed that at length. But I think, again, coming together and partnering on work and research is one way to overcome that. So I see, for the climate and health work anyway, I see a great many opportunities around health research in northern BC to collaborate not just with UNBC and the HRI and Northern Health, but FNHA and other partners who are pursuing this work. And there's a lot of activity in this space already happening as well that we haven't quite tapped into. And so, yeah, there's lots of opportunities. There are lots of research questions that need answering. We just, yeah, we have a huge gap around this knowledge in the North. So, yeah, we'll pass it on to the next person from there.
Oh, that's great. I'm just gonna pop this up for 1 second because Diana has put in the email address for the FNHA research and knowledge exchange. If you guys didn't catch that, it's available. All right, coming back into the room, Carolyn, would you like to have some final thoughts?
I'm from a professional program, so I can't help it, but I'm going to speak to that. Is I would love to see us have more excitement of research in nursing, so that we can see it in where we take out into our, for our student nurses, so that we can see about the things that we could do and start with quality assurance work as part of our everyday activities to be able to think about the change that we can bring. Historically, again, sorry, I am from a professional program. I know, and I'm smiling looking at Richard, so I'm going to throw him under the bus, but I know that from a technology point of view, lots of nurses have great ideas, as you will have great ideas about what you see in practice and actually what's not working or what's an opportunity. So I think that there is ways that we can build partnership when we see things that are happening in a clinical space that we could say, isn't there something we could do better? I would love us to see a bit more AI. Let's face it, it's not going to go away. It's here for life. It's a bit like the Matrix. And if we are in the Matrix right now, oh dear, never mind. So, I think we've got to think about where that's situated to and how we bring some of those things in. So for me, they're really exciting things, is to be able to see, I'd love to see how that partnership would grow. And I think the work that you do, Richard, is fabulous. And I also know it from a pediatric point of view through BC Children's and the work they do in relation to technology and innovation. And I'd love to see how that we can situate that within a more secure space within Northern Health too, so that to make sure that there is a good way for us to be able to tap in what's coming, for you to use your creativity and your ingenuity to be able to change our futures, because it will be the technology that helps when I get older. I know that I'm not naive, because there's not going to be enough warm bodies to do the things that we need to do. So how's technology going to be able to help? So for me, that's an exciting opportunity. And I think it's something we kind of have a little bit of opportunity with the CTAN network that Richard works with. But I think there is definitely an opportunity to build some stronger and deeper links there in relation to AI and technology and innovation in that partnership work, and have that. I don't know, Marcelo, do we have anything in Northern Health right now that kind of is situated in that way? Sorry.
Rich might be the better person.
I was actually going to return the question to you because
that's not fair.
We have that. One of the advices that I just recently read about preparing master and doctoral students, which was like, that's quite basic, but I thought about it, it's like, actually, it's quite true. Show enthusiasm, like literally send that email, knock at the door, etc. So basically, I know and I recognize we might have untapped resources at Northern Health that just because they don't see themselves working with professors or academics, they might have research questions. Although, let me tell you, behind the scenes, we're in a big process of doing some interesting work around a concept that we can explain in the future about service networks, that one of the benefits of the service networks is that we'll actually distill questions that could be translated to research questions, and then we can look into academia. So hopefully once we do this process that we have been going through some time, it's gonna be able to bring clarity into the type of questions that some of our practitioners are thinking. But right now there is no formal mechanisms to do that. So meanwhile, if we fix the system, I encourage you to just literally send that email, do that phone call, show enthusiasm, literally just be honestly interested. So the project that we're talking about is maybe something that, because it's not just about Northern Health, it's also about academia, right? And that we don't know what professors are working on. Like, we know some of them because we know personally, but also if there might be also some other ways to kind of showcase that X, Y, or Z are willing to take on additional projects, that would be great. Like, for example, some universities, there is the directory, and they said open to supervised master students, PhD, and open to the research in X, Y, or Z. I'm not sure exactly if
We do that.
we represent
Yeah.
this. Okay. But yeah, so there's the intent to try to bring together to continue developing these untapped potentials. Yeah. And these seminars, these type of activities are natural places for this to happen.
Yeah. Leanne, just going on that for a second, I'll get your final thoughts, but with the HRI kind of database, will partners, community partners, or people with Northern Health, is there any way that they can access kind of that database to do the networking, or is that just kind of a special?
No, anybody who's an HRI member
So
will have access to the database, and you can be a Health Research Institute member if you're interested in health in the North. We do vet because we don't want bots on there or people just trying to get the email list to advertise. But right now, our membership is a lot of UNBC, a lot of Northern Health, and then people from First Nation Health Authority, Rural Coordination Center, BC, Provincial Health Services Authority, and hopefully with the development and release of this database, we'll have more and a bigger influx of people seeing the value of being an HRI member. And then because it's a searchable website and everybody on there sets up their own profile, you can put on there your research interests, this and that, then other members will be able to look for you and then reach out and email you. Yeah.
that's good to know. I didn't know membership was open to kind of everybody in the community that are focused on health research.
Health research, yeah, if you're interested in health in the North and you'd like to be and it's beneficial to you and to us to be a member of the Health Research Institute, yeah, health research in the North. Yeah.
All right, so maybe I'll just give you a second to have any final thoughts on kind of how you feel like this partnership can kind of evolve to either address hurdles or see some kind of opportunities to continue to help build research capacity.
Yeah, absolutely. Well, from my perspective, I see such deep value in partnerships. We're very unique. We're in a unique position in the North because we are a smaller, more under-resourced. I do see a lot of development of good personal relationships. I see a lot of work be done because this person has worked for years with this person, and so that can be a little bit of a detriment too, because it can be on the shoulders of a particular individual. But our relationships and our work partnerships are constantly evolving. We're always looking to move forward, to reach out, to develop deeper and further partnerships, such like with the National the NCCR, the Northern Center for Clinical Research. That's something new, and they're building their staff, and we're meeting with the staff and we're talking about what we can do together. We're not right in the position to do it now, but in the future, do we want to host events together? Do we want to do this? Do we want to do that? So I just see more of that.
the more partnerships we get, the more acronyms we have to remember.
Oh, gosh, yeah. Even when you think you know it and you have to say it out loud, you don't know it anymore.
I just want to share that someone posted that
Yeah.
they wanted to give a thumbs up to Caroline on the AI. Referencing, so I think that's.
Awesome.
Okay.
See, Rich, there's always going to be a job for you, always.
Okay, well, one more big thank you to all our panelists here. And if I did not mention it, I do want to say that this seminar was co-hosted both by the Health Research Institute and Northern Health. And we have our panelists here from both of those kind of organizations that, yes, did a fantastic job. So join me. And please do, if you're in the room, feel free to come down. They would be happy to chat with you.
Or drink some more coffee.
Drink some
We
more
try to